All right, so for all Houston firefighters, you're about to see a video about how to put on the PPE for, in the event that you should come across a patient who you feel may have been infected with Ebola. The equipment that you're going to be using, the Tyvek and Tychem suits, are nothing new to you. You've had these in your Pelican cases for years, and I assume that each and every one of you has already been trained on donning this equipment at least once in your career. But certainly it's time to review it in light of certain circumstances. Let me just remind everyone that there's been a lot of attention in the media about the Ebola, and quite deservedly so. It is a virus that at this point, even in modern healthcare settings, still carries at least a 60% mortality rate, death rate. And we've seen in the beginning in areas of West Africa and in the jungle where there is minimal healthcare that has had up to a 90% death rate. So it's very, very serious. On the other hand, the chances of you coming across a patient, at least at this point, remain very low. We've had 3 cases here in the United States. That means it's literally 1 in 100 million people in the United States have been infected. Nevertheless, we are all keenly aware of what a mobile world it is, what a mobile society we have in this world, and that people are traveling. And just like the case with Mr. Duncan in Dallas, who was the index case there, he traveled from West Africa and was not ill until after he arrived here in the United States. And so that's the scenario that we all need to worry about. As we go through this, keep in mind that this is a very dynamic situation. There are all kinds of plans that are evolving as we speak, and whatever I say here now and whatever training that you're about to receive, don't be surprised if it should change as we learn more, and don't be upset by that. As we learn more, we're going to pass that information along in order to make sure that you've got the protection that you need. Also recognize there's going to be lots of mixed signals. There's going to be lots of opportunities where we're going to be able to say that this person or that person doesn't know what they're doing or know what they're talking about. And that's probably a little bit unfair. Let me give you an example. Right now we're talking about when patients have fever, that's one of the earliest symptoms in Ebola infection. And that's true. So what is a fever? Well, if you look in any medical dictionary, it'll probably say a temperature of 100.5 or greater. If you look at the CDC guidance that's come out, they are repeatedly quoting a temperature of 101.5. If you look at the Texas state statutes in the Health and Safety Code, it says a fever in the state of Texas is defined legally as a temperature greater than 100. And then most recently, in the nurse who was traveling from Cleveland back to Dallas, she felt feverish, took her temperature. It was 99.5 when she called the CDC. And the CDC worker then said, well, that's not a fever, and said she was okay to fly. Subsequent to that, it was determined that she was infected with Ebola. So there's all kinds of comments going on about how that shouldn't have happened and so on and so forth. But you know, we all need to be reasonable. The key thing there, I think, for us to take away is regardless of how you define a fever in terms of temperature, if the patient feels like they have a fever, or if maybe when you're examining them, if they feel warm to you, and in addition, they meet the risk factors, which we call the epidemiologic risk factors, that being that they've been in one of the countries in Africa that we're worried about, or perhaps they've been in Dallas and they're on a list of people that are being watched by the health department. If they have those 2 factors, then we probably need to act as if the patient is potentially infected with Ebola. So again, you're about to see a policy and procedure training on donning the equipment. When it comes to doffing the equipment, our hazmat team has stepped up, and they're going to, in any case where our folks put the equipment on, they're going to be the ones who will be overseeing the doffing. So as you watch this, you may ask the question, why? Well, they told me how to put it on, and they haven't told me anything about how to take it off. That's because that's going to be done with the assistance of hazmat. And again, that is for maximum firefighter safety. So let me just finish up by saying that this is an evolving, dynamic situation. We're all looking out for your best interests. Bear with us as things change. You'll get that notification. And let's hope that we never have a case here in Houston, but if we do have one, you need to be prepared.